Well, good morning, folks. It's time for another FYI, and this morning we have the Henry County Health Center with us, and I'm really excited about our conversation because we're going to be talking with the certified nurse midwives. Good morning.
Good morning.
Well, first, why don't you both introduce yourselves and talk a little bit about your experience and everything that you bring to the health center.
Okay, my name's Carrie Payne. I've been at Henry County since 2002 as a nurse for a long time, and then as a midwife since 2014. I went to school all locally. I went to Southeastern first and did actually 3 years there and got 2 degrees. I went to Iowa Wesleyan after that and got my bachelor's in nursing, and then I went to a distance program through Philadelphia University and did my midwifery certification there. I have my master's in midwifery. That's what my certification is, and I did all of my preceptorship, which is sort of like a residency, right? It's where you take care of all your patients and get your hours and numbers in at Great River with the midwife there at the time, Becky Winnicky. So
the bigger question to me is, it sounds like you're very qualified. Why did you decide to become a nurse midwife?
I fell in love with birth when I was about 15 years old. I always knew I wanted to do something in the medical profession because I like science and numbers. And then my cousin, who's 10 years older than I am, was pregnant with her first child, and they allowed me to go into the delivery room, and I got to sit behind one of the physicians at Great River. He was so nice. He let me sit behind his shoulder while he did the delivery, and I got to cut the cord of the baby, and I just fell in love with birth. I was like, this is what I want to do. So.
That's awesome, Carrie. Thanks for being with us this morning.
So my name's Kendra Bonnesen, and I am the other nurse midwife at Henry County Health Center. I started this journey as a nurse. I graduated from Iowa Wesleyan with my BSN and worked in Ottumwa as well as here at Henry County Health Center, and developed a passion for taking care of women, young families, people during the birth process, as well as older children. And so I went back to school to Frontier Nursing University, which is in Hayden, Kentucky, and graduated first with my family nurse practitioner degree, which is a master's in nursing, and then added on the certified nurse midwife certificate. And so that we came here in 2014 for midwifery and have been practicing here ever since.
And so, again, sounds like there's a lot of certifications that you have to get to become a midwife and all sorts of things. So one of you explain what a certified nurse midwife is.
So a certified nurse midwife is a nurse who then becomes a midwife. We are healthcare providers that partner with women to make their healthcare decisions and care for them, just like other healthcare providers would in many instances. We provide well woman care. We provide care during pregnancy, birth, help with breastfeeding, care of newborns, as well as care throughout the ages for women. So anyone who is an adolescent all the way up through elderly women, we take care of them as well.
And I know that the Henry County Health Center's maternity services are kind of going through a transition right now where you're going to be closing the birth portion of it on May 31st. So as certified nurse midwives, what OB services will you continue to offer here at the health center in Mount Pleasant?
So while our place of birth is going to change. So the labor and delivery unit is going to close here in Henry County, and it saddens us. And there are lots of wonderful nurses we've worked with for a long time. And that portion is gut-wrenching. It's like losing part of your family because we're all so close. But we're partnering with Great River to have a delivery site in the area. So the only thing that will change in our clinic is the site of delivery for our patients. We will continue to do prenatal care, postpartum care, all locally, as well as newborn care. We have a shared care model. We've started with Dawn Rohr, the midwife down at Great River, who has been trained exactly the same as we have to share our prenatal patients. So our prenatal patients that desire to deliver at Great River and have a chance of Kendra and I catching their baby will see Dawn for 2 visits during their prenatal care. And then whichever one of the 3 of us is on call will catch her baby. So during the week, it will be split. Dawn will cover 2 days, we'll cover 2 days, and then we'll all 3 rotate Friday, Saturday, Sunday weekends. we'll continue with our, birth control visits. We'll continue with our well woman visits. We'll continue with our care of menopausal women and helping them through that transition as well as our care of postmenopausal women and what that maintains. And Kendra, of course, will continue her family practice as well.
This is a big change, but it's not one that people should be nervous about because you guys aren't leaving. You're going to still be there. And I know from personal experience how much having your midwife is important to you. We love you guys and we don't want you going anywhere. So thank you so much for clarifying that. You're going to be continuing to offer all of that prenatal care and well women visits and all of that right here, just like always at the clinic, at the hospital. But when you give birth, you will drive to Burlington. We've talked a little bit about that shared care program. Is there anything else that we need to touch on that?
So I think we will be working with the both Dawn and the OBGYNs at Great River, who are excellent providers. And if a woman develops a problem, a complication during her pregnancy, we also will be working with them. If a woman chooses to deliver at a different hospital or has had a C-section and needs someone who specializes in vaginal birth after cesarean section, then they usually go to Iowa City to one of the hospitals up there. And we have always partnered with the University of Iowa High Risk, as well as some of the OBGYNs at Mercy in Iowa City for shared care. And we will continue to do that if someone needs to have specialty care up there or chooses to deliver up there. We'll still continue to do those things. And then women who deliver, even at Great River, if Dawn, the other midwife, delivers there, they will still come back to our clinic for local postpartum care and all of the lactation support that we offer in our clinic.
And touch a little bit on that, Kendra, on why it's so important for, what are the benefits for women receiving their care locally versus having to go all the way to Burlington to do that?
So one thing, of course, is that you don't have to travel. A lot of women who are having children are young families and they're busy. They have other children. And so just driving to even just to Burlington can be cumbersome. So we offer all of those services here. We communicate very well with the other primary care providers here in town, as well as we have time to get to know each of our patients that we take care of and their families, their husbands. And so we get to know them very well. And then when it comes time to see them after the baby's born, it's helpful to have that established history and relationship with someone so that if you are having postpartum concerns or difficulty with adjusting to a brand new baby or anything, I feel like women are more apt to talk to us to bring up those problems that they might be having.
And so I know there's kind of a misconception out there about certified nurse midwives and that they only work with pregnant women. But like we've touched on, you care for women of all ages and all stages in women's health. Can you talk about, kind of expand on maybe some of those services that you offer for women that are not currently pregnant?
So if you think in an age line, a timeline, so we start with girls who are first starting to menstruate, right? They're first starting to have their periods. Some parents are uncomfortable talking with their daughters about what that means, or really they didn't have the education themselves. And so we start with visits to just speak to these girls about what's happening to their bodies, what's normal, what's not normal, when should you call us, how do you take care of yourself, what to expect. And then you kind of move into the spectrum where people might be concerned that they're having abnormal problems with their periods or concerned that they may have a sexually transmitted infection or be in the age group where they're looking for birth control options or help with their periods. Maybe they have normal periods, but they're heavy and crampy and they need help with that. So then you move into kind of that adolescent age group or your young married couples, people who are planning on getting married and want to do some preconception counseling, and we can talk to them if they're on medications or if they have special medical concerns about what do you need to do to get yourself in the best health possible to set yourself up for a healthy pregnancy to the best of your ability, right? And then you move into, you have your moms for labor and delivery and your newborns, but you also have well woman exams. Once a year, you should go see your provider to have a well woman exam and just have your blood pressure checked. Get your screening, your cervical cancer screening, your mammograms, your colonoscopies, all of that kind of stuff. And then once you get through those years and you move on into menopause, menopause is just as a huge of a transition as starting your period. So you need somebody to partner with you and tell you, yes, this is normal. These are some things you can do. Or if you hit your wits end, say, these are some other therapies that we can offer you in addition to your lifestyle changes. And then you have our elderly population who may be suffering with incontinence or pelvic organ prolapse. And that's where we can sit down. And even though we are not the surgeons, we can partner with those women to talk about all of the options, surgical and non-surgical, and get them referred out to a provider who can meet the needs that they want.
So if there is someone out there listening who fits any of those categories and they maybe aren't happy with who they're at right now, or they're just looking for some other opinions and they want to see you guys, who can they call? What is the process for setting up an appointment with either you, Kari, or you, Kendra?
So all they would have to do is call the Rural Health Clinic at Henry County Health Center, and the phone number is 385-6770. And our telephone options, they would just follow the prompts and select the one for scheduling, and they can get them in for an appointment with either of us for their problems and to meet all of their needs. Even if they choose that they don't want to do anything at that time, just having the options available and some counseling about what's normal, what's not normal, what you can do if things get worse. So that's
part of our education. While we're educated in what's normal in pregnancy and outside of pregnancy, we are also educated in the problems and how to manage those problems. So we are specialists in the area of women's health and in pregnancy as well. And in both areas, we are knowledgeable about what is abnormal, some of the ways to treat abnormal, and if that goes beyond our scope of knowledge, where do we refer to so you can get appropriate treatment?
And that's, like you said, so important to have that person that you first can call and get then to, they can help you with that referral process, because that can be overwhelming, especially if you're not feeling well or you're having some type of issue and you're desperate. It's nice to have, that relationship set up with your nurse midwife, so then they can kind of say, okay, here's the specialist that we recommend. So thank you so much, you two, for coming on. Of course, we wish you well in the transition of moving the birth services to Great River Medical Center, but we're happy to have you still in Mount Pleasant at the Henry County Health Center, offering services for women of all ages and stages of life. So thanks for coming on this morning.
Thank you.
Thanks for having us.